Well, my name is Lori Davian, and I'm a patient of Dr. Ashraf's, and he's my rheumatologist. About 6 years ago, 6 years in September, we had left the homecoming football game. My girls were in high school. My daughter had worked in the concession stand, and she was going to spend the night with her friends in a different town. And my husband and I went to Walmart, went home, and got all settled. We were watching TV, and there was a knock at the door, and it was the law enforcement to tell us that she had been in an accident, and she was already gone. There was no moment of hope. By the time they knocked, she had passed. And at that moment, I clenched every muscle in my body. I just tightened, and that's how I stayed. And so the morning I would get up and be hunched over and stiff and have to take a hot bath or a hot shower. And it was that way for about a year until the pain was different, and I started having a lot of pain in my joints, and stiffness that wasn't muscular. And so when I went to my doctor, there was always this, well, we know your grief manifests itself physically, and it does. This went on for several years. I would have a blood test run, just, let's see if you have rheumatoid arthritis. Oh, it didn't show up, so no, it's just your grief. And I woke up one morning and I couldn't walk. I could stand, but I couldn't bear weight to take a step. And so I went to the doctor. We're going to refer you for an MRI. So went for the MRI, give you some pain pills, and it didn't get any better. We're going to send you to a neurologist. Neurologist said, well, your back really isn't that bad for someone your age, so we'll send you to pain management. Pain management, I got 2 spinal epidurals. Didn't help. We're going to send you to physical therapy. It was just this kicking the can down the road type of thing. And I even began to question myself, like, am I crazy? Is this really just all this is? Do I just need to cope better? And was I a hypochondriac? Was I making all this up? Because I was just dismissed. Everywhere I went, there was just this dismissal. So, and he was my last chance. I wasn't trying after him. That was it. I called to have my pain medication renewed, and a nurse pulled the file and said, oh my God, here it is. It's been here the whole time. And on a blood test that I'd had, my ANA titer was as high as it could be. It had been misread by my doctor's office, and so they reran the blood test, and it was a year since this bad blood test, and it was that high again. And he said, I think you have an autoimmune disorder, and we're going to send you to a rheumatologist. And it was at that point that, I'd had the emergency room visits, I'd had all of this stuff, and I just kind of thought, I am taking control of this situation now. And so I made a list of all my symptoms, got all my test results, got my MRI results, and called Dr. Ashraf's office, and the woman said, I can get you in next Monday, and this was on a Friday. When he came into the office, he took my hand and looked right in my eyes. And he had all my information there that I had given him. And he proceeded to go through the symptoms and tell me, I think this fits here, this fits here. And it was a pretty complex diagnosis because I had several different autoimmune things. And he would periodically stop and say, do you understand? Do you have any questions? And then he would ask questions of me, and he would wait for my answer. I was so used to just being shuffled through. I'd driven 2 hours to a neurologist in Tulsa, and I spent 5 minutes with him. And then here was Dr. Ashraf waiting for my response and giving me that think time. He asked so many questions for clarity and for him to gain understanding, and he listened to me, and he listened to the message that my body was trying to convey to him and to me and to the world, that I was sick. At the end of the appointment, he took my hand and he said, you're going to get better. And I started to cry. And I thanked him for not dismissing me, and thanked him for not attributing this to my grief. And he said, oh, no, this is something that we can work with. So, fast forward a couple of months, and I've gotten the blood results, and I'm on the right medication and everything. I am having less pain than I have had in years. I'm able to play with my grandkids. I'm able to stand and teach. I'm driving myself back and forth to school. And it's just, I feel like I feel like that he probably saved my life. I was sick, and I was getting sicker, and I was discouraged. He is amazing, and I don't say that he saved my life to be flippant. He saved my life. I fully believe that, because I had given up on I thought I was going to have to retire, you know. I thought, I'm never going to run a marathon, which I'm never going to anyway. But I remember thinking, I will never do those things that I thought, I'll do this someday. You know, that's where I was. I was like, those opportunities have passed. He is my partner in fighting autoimmune disorder. I recommend him to anyone, and I recommend Stillwater Hospital to anyone, because that's the culture. There is this culture of listening here, and even when I'm checking in, like the woman that checked me in last time, we discovered that we were named after the same kind of relative, and we have the same name. You know, just those conversations are everywhere, and there's just that culture of communication here, and I really appreciate that. So that's the feeling that you all send out to patients, is that that we're here to be, because we're sick and we're scared, and that's what we need. We need someone to comfort us and say, we can help you, we can make you better.